It's time to talk health with Dr. Tamara, and this week we're discussing an often controversial subject, weight and what's normal. We're usually led to believe, predominantly through advertising, movies and television, that skinny is better, but it can be quite the opposite. Dr. Tamara, thanks for coming back to 9 Live Perth. Let's start with why people's perception of what looks good can actually be so far off the mark of what's normal and healthy.
Yeah, thanks, Emmy. Look, this is a really controversial area, and particularly so with next week being Healthy Weight Week. Researchers have actually shown that women tend to see themselves as much bigger than they actually are and desire to be much smaller than what is the ideal. And men, on the other hand, tend to see themselves as much smaller than what they actually are, but desire to be much more muscly and much bigger than they are. And popular media tends to really play on this and portrays these images to us that are really much different to what the ideal or the normal should be.
So given that perception, how do we actually know if the weight we're at is normal or healthy?
Yeah, well, we have a common way of measuring weight called the BMI, or body mass index. That is your weight in kilograms divided by your height in metres squared. So obese is a BMI greater than 30. Overweight is a BMI from 25 to 30. A normal or ideal weight is 20 to 25, and underweight is 20 or less.
But we shouldn't be looking at that so strictly, should we?
Well, it is a measure that we use a lot in medical research and evidence-based medicine. So a lot of the research has been based with regards to health conditions around the BMI, but certainly BMI can be affected by, say, muscle mass, and fat mass is really the most important thing when it comes to health.
So where are most of us West Aussies at with their weight? How big a health crisis is it for us?
Look, it's an increasing health crisis, Emmy. We know now that most disease processes, cardiovascular disease, type 2 diabetes, even some cancers, have overweight or obesity as major risk factors. So it's something we do need to address for our health. We know that 2 out of 3 Australian adults are now overweight or obese. We know that 1 out of 4 children is classified as overweight or obese. So we certainly have a long way to go in really addressing that. Now, a lot of people worry that being underweight is also a risk factor for health issues, and certainly there are some conditions, but with only 1.7% of Australians classified as underweight, I think we really need to be addressing the obesity and overweight issue first and foremost.
I know, and the one I've been waiting for, what are your 5 strategies for maintaining a healthy weight?
Look, there's lots of strategies, but I like to keep it real simple. The very first thing should be diet. I have an 80-20 rule, 80% of the time eating whole foods, lots of fruits and veggies, whole grains, good proteins. 20% of the time treating yourself, not making it an everyday habit, however. I think portion control is super important. Small and often is the way that we should be eating. Strategy number 2 would be exercise. The best sort of exercise is the one that you're going to do. That can be anything from Zumba to walking the dog around the park. And look, if time is of an issue, then just increasing incidental activity, using the stairs, not the escalator, getting out to the park with your kids is a really good one. Strategy 3 would probably be water, water, water. Sometimes people confuse thirst and hunger, so having a glass of water, waiting 15 minutes to see if you really are hungry is a great strategy. Strategy number 4, I think a lot of people use emotional eating. A lot of people tend to reach for high-calorie foods when they're fearful or angry or even stressed, so really being aware of emotional eating. And my 5th strategy, particularly for families, is recruit the whole family. Make sure that healthy weight is the objective, eating together,
Bit
eating
of peer
good
pressure.
food. Absolutely, and being accountable to the family is the best way to be.
Oh, I love it. Thanks for those 5 tips. Dr. Tamara, thanks for your time this afternoon.
Thanks, Emmy.